Before starting our lecture, we discussed a case of a 41-year-old female who was suffering from the symptoms like there was the fatigue, there was weakness, there was weight gain. That was the most prominent symptoms or the clinical presentation. Now, the questions that we raised there was the diagnosis, what is the most probable diagnosis, and what are the causes behind the disease. Now, you have studied everything about the hyperadrenalism. You have studied about the cortisol hormone, the glucocorticoid, the aldosterone, and the androgens. We have studied about their symptoms in detail. Now, just focus upon the symptoms of the female that she is presenting. She is presenting with a muscle weakness, with a fatigue, with a depression, and she is suffering with a weight gain as well. Now, correlate these symptoms with all the three conditions that you just have studied. You can appreciate that these are the symptoms like the psychological symptoms and the muscular symptoms, and there is the weight gain as well. All of these three types of the symptoms we discussed when we were studying about the hypercortisolism. So we can here conclude for once that the patient is suffering from the hypercortisolism or Cushing syndromes. Moving on, when you move toward the diagnosis, the MRI was performed that shows that there is a mass or nodule inside the lung that is of 1.5 into 1.5 centimeter. Now, what does that indicate or how it will help you in the diagnosis? When we were studying about the hypercortisolism, we said that the reason behind hypercortisolism can be the adrenal tumor, iatrogenic cause, there can be the pituitary tumor as well, and there can be the paraneoplastic condition. In the paraneoplastic condition, we said that there can be the neoplasia, tumor, or nodules of the lungs that can lead to the hyperplastic condition. So here the patient is presenting or with a nodule or mass in the lungs, and also she is presenting the symptoms that are all related to the hypercortisolism. So you can clearly say that the patient is suffering from the hypercortisolism or Cushing disease. So what is the diagnosis? The most probable diagnosis is the hypercortisolism. And what are the findings that will help you in diagnosis that I just told you? The symptom of the female that she is suffering from the fatigue, weakness, and the psychological symptom, muscular system symptoms, and the also the most prominent symptoms I forgot is the Cushing-wide appearance of the female. She's overweight and also the Cushing-wide appearance. The patient who is suffering from Cushing syndrome, it is very easy to identify him or her because of its appearance. So you can easily identify, and then later the diagnostic test that MRI is also confirming that the patient is suffering from the hypercortisolism or Cushing syndrome. So this was all about the hyperadrenalism. We discussed that what can be the reason behind hyperadrenalism, what can be the three diseases, three consequences of the hyperadrenalism. There can be the hypercortisolism, aldosteronism, and androgen-related syndrome as well. So we discussed all of these diseases in detail about the pathology, their symptoms, and the reason behind their symptoms. Now, also we studied that how you can diagnose a case through symptom and the pathological condition. So this was all about the hyperadrenalism. Thanks for watching sqadia.com.